how many decompressions do you do maybe in a year or in a month? And is that something that patients should be looking for in the surgeon that they see for their surgery? How well specialized do you think the surgery is, I guess?
Um, I think the operation is, I think it's deceptively simple. What I mean by that is conceptually, it's relatively easy. I think almost every neurosurgeon in America thinks they know how to do this. It's not really technically demanding to do an average Chiari operation. But there's a big problem with that because we were talking about all of the complications that people get and the CSF leaks and pseudomeningoceles, and that can absolutely devastate patients. And that is something that surgeons really need to pay attention to. So I think every or most neurosurgeons in America feel like they can do this operation. But in my estimation, yeah, I do think it's something that you should ask about. How many have you done? What's your success rate? What's your rate of getting leaks? How would you handle it if you got a leak? Because you really want to avoid that complication. You want to avoid any complications. So I think probably just like any operation in general, I mean, I can't think of really anything that you shouldn't ask that question for. But yeah, you should ask your surgeon how many they've done, what their success rate has been, what their complication rate has been, and whether this is something that they consider themselves expert in. Because if it's done poorly, it can be devastating, and in some cases, it can affect many years of your life before you can actually get your life back on track. So, yeah, I think it matters a lot.
Is there a good number, or is that a loaded question?
I think I don't think I would set an extremely high minimum number. I probably I see a couple hundred Chiari patients a year probably and operate on about 50 of them a year. I'm pretty selective, as you've heard, in terms of who I'm recommending surgery for. At least I think I am. I think that if somebody does fewer than 10 a year, they're probably just not really a Chiari malformation person. They're just a neurosurgeon. I shouldn't say just a neurosurgeon, but they're a neurosurgeon who just does a lot of other things and happens to operate on the Chiaris that come in the door. I guess I'd be, and they might do a great job in some cases, but you should know that they're probably not very thoughtful about Chiaris as much as whether or not you get a good operation. I think I'd be equally concerned about whether they're helping you make the right decision. Are they recommending surgery when you need it, or are they not recommending surgery when you don't need it? And I think that's relatively good to know that you're seeing somebody that sees a lot of Chiari and is thoughtful about Chiari with respect to that as well. Now, even people who see a lot of Chiari, frankly, you'll see disagreements, and I think that's very frustrating for patients that see three people that all consider themselves experts in Chiari, and they got three different answers, and people wondering how could this possibly be. And unfortunately, that's just the state of the science right now, is that there is going to be some disagreement, especially if you're in kind of a gray area. But at the same time, I think at least seeing people that see a lot of Chiari is helpful. Yeah. So yeah, again, simple question with a complicated answer, but I think it is a simple operation to do. Like most people can do it, but that you don't necessarily want to just have the basic operation by somebody who's done it a few times. I think you're going to be in better hands going to somebody who does a lot.
Is there a way? How would patients? So say they go into the whatever hospital they're at, whether or not it's a medical academic institution, how do they know whether that surgeon's qualified or how familiar they are with the surgery? Is there a way to do that?
Well, yeah, there's a lot of ways to do it. I mean, the simplest way is you should ask them. I think everybody should feel very comfortable with their surgeon. If you're afraid of asking them that question, then you don't have a good enough relationship with them for them to be your surgeon. I'm never offended by those questions, and if the surgeon's any good, they really shouldn't be. So ask them directly, like, how many Chiari surgeries do you do? Have you written papers on Chiari? Do you think about Chiari? Are you in CSF? These are kind of basic questions. And the other ways you can do a little bit of a background check is just go to their website. You know, do they talk about Chiari on their website, or do they talk about, you know, doing a lot of disc surgery or you know, brain tumor surgery or some other thing? I think it doesn't mean that they're not a Chiari expert if they don't mention Chiari, but you know, you might want to seek out somebody that's at least talking about Chiari. And then other really good things is, you know, look at their board certification status. So the American Board of Neurosurgery, abns.org, maintains a list of all board certified neurosurgeons in America. And your neurosurgeon should be board certified. So if you have an appointment with somebody, just look them up and see if they're on the list. And if they're not, and you want to keep your appointment, maybe ask them why they're not on the list.
Right.
But I think that's another very basic thing that you should do to check out. You know, depending on what state you live in, there's ways of retrieving malpractice history of physicians in some states. And that's another thing that I think is reasonable to check out. The state of neurosurgery in America right now is there are some very good neurosurgeons that have a malpractice history, but you want to make sure that there's not too much of a malpractice history. That's sort of, you know, in some cases the malpractice history kind of tells a story, and you want to make sure not to see somebody like that. So I think that would be my best general advice. Ask the surgeon directly the questions that are on your mind, but yeah, you can do a little bit of a background check too.
Yeah, nothing wrong with that.
CSF, right? Do you mind if I say that, Caitlin? I think your office gets a lot of these sorts of questions, right? I think as far as I know, you've told me that your policy is not necessarily to recommend individual people, but you'll at least provide this sort of kind of general advice, I think.
Yeah, we basically, you almost said it verbatim. So
Yeah.
that's kind of what we tell everyone to do.